Hi and welcome to our telehealth video information series. My name is Garvin and this video is on Questran Sachets. So first, what are Questran Sachets used for? They're used for a number of indications, including high blood cholesterol levels, preventing coronary heart disease in men aged 35 to 59 who have high blood cholesterol that has not responded to a cholesterol-lowering diet or other measures, and relieving itching caused by partial blockage of the bile ducts or a form of liver disease involving the bile ducts. It's also used for relieving diarrhea associated with Crohn's disease, surgical removal of part of the intestine, and removal of the nerve supply to the gut, decreased nerve supply to the gut due to diabetes or radiation therapy. So a number of indications. So how does it work? Questran sachets contain the active ingredient colestyramine, which is a type of medicine called a bile acid sequestrant. Colestyramine is not absorbed into the bloodstream. It works in the intestines where it binds to bile acids. Bile is a fluid that is produced by the liver. It is released into the intestine through the bile duct as part of digestion. Bile contains substances called bile acids, which the liver makes from cholesterol in the blood. Bile acids aid the digestion of fats consumed in the diet. Following digestion, the bile acids are reabsorbed into the bloodstream and are then returned to the liver. Colestyramine binds to the bile acids in the intestine and prevents them from being reabsorbed into the bloodstream. Instead, they pass through the intestine with the colestyramine and are excreted in the feces. This triggers the liver to produce more bile acids from the cholesterol in the blood, which lowers the level of cholesterol in the blood. High cholesterol levels increase the risk of heart disease by clogging and narrowing the arteries, which is atherosclerosis. Colestyramine is used to lower cholesterol levels and thus reduce the risk of hardening of the arteries and the problems this can cause. It may be used on its own or in combination with other cholesterol-lowering medicines. Medicines are used to lower high cholesterol levels when a low cholesterol diet and exercise regime have not done this sufficiently. However, it is important to continue to follow your cholesterol-lowering diet while taking this medicine. Colestyramine is also used to treat people who have an obstruction of the bile duct or a form of liver disease involving the bile ducts. A blockage in the bile duct can cause bile acids to build up in the blood and then be deposited in the skin. This can make the skin itchy. So colestyramine reduces the levels of bile acids in the blood and so reduces the amount of excess bile acids deposited in the skin, and this stops itchiness. A further use of Questran is in the relief of diarrhea associated with various conditions in which bile acids are not properly absorbed from the intestine. Questran relieves the diarrhea by binding to the unabsorbed bile acids. Questran should be used with caution in children with inherited high blood cholesterol and diabetes. Each sachet of Questran contains 3.8 grams of sucrose. Also, Questran should not be used in the total blockage of the bile duct. And this medicine is not recommended for children under 6 years of age. And this medicine should not be used if you are allergic to any of its ingredients. So what about using Questran in pregnancy and breastfeeding? The safety of this medicine for use during pregnancy or breastfeeding has not been established. The medicine is not absorbed into the bloodstream, but it may cause deficiencies in fat-soluble vitamins with prolonged use. For this reason, it should be used with caution in women who are pregnant or breastfeeding, and only if the potential benefit to the mother outweighs the risks to the baby. A special warning regarding Questran sachets is that the sachets need to be dissolved or mixed with water before taking it. And next we look at the side effects of Questran. They are constipation, diarrhea, high levels of chloride in the blood resulting in high acid levels in the blood, and increased tendency to bleed due to vitamin K deficiency and blockage of the intestines. So how can this medicine affect other medicines you're taking? Questran may interfere with the absorption of other medicines from the gut if they are taken at the same time as this medicine. To avoid this, other medicines should be taken at least 1 hour before or 4 to 6 hours after taking Questran. If you're taking any of the following medicines, your treatment should be monitored, as Questran may alter the effects of these medicines, even if the above advice, what I just said regarding timing of doses, is followed. These medicines are acaribose, amiodarone, and anticoagulants such as warfarin and glipizide, which is for diabetes. Also, Questran significantly decreases the effect of leflunomide and should not be given to people taking leufonamide unless it is needed to wash out the leufonamide out of the system. Questran is not recommended for use in combination with raloxifene. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info or call into us at Lynch's Pharmacy in Douglas and Cork. You can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.